When you're mixing, you can actually let the PRF sit while you're numbing your client, doing charting, getting things ready. As soon as you mix it with the fillers, when your clotting time starts. But also notice this, you can see that fibrin clot has already been about 5 minutes, and that fibrin clot has already started to form. So it's not a big deal. If you have that, you can either leave it in there or you can just put it out on a piece of gauze, but you can see that it's already starting to clot. So what not to do with PRF. Now this is nice because we have a really nice sample. We were able to mix all these products with PRF and we still have quite a lot left over. So you can always cannulate this, or with a needle, put this in the dermis of your client's skin. It will still give them a little nourishment to their dermis. No need to waste it. Here's a few things that you don't want to do. When you're drawing up the PRF, if you do get a little bit of a clot and it clots in your needle, what I normally do is I will just pull it out with my needle and put it down on the gauze, because if you're drawing it up and you can see more of that clot forming, so let's say I draw it up like this and my needle gets stuck, if I push back down in, I'll show you here. So if you push it back down in, you can see that blood start to come back up. Let me see if I can get you a better sample. So you pull up and then you don't like the sample that you get. If you release this back down into the PRF, it totally mixes your blood in your PRF. And the only thing that you can do then is respin it and hope that you'll get that PRF to settle again. So make sure when you're drawing up, you don't push it, you don't try to release a clot by pushing back down into the sample, because that will bring all of those red blood cells up. Another thing that you don't want to do, if you have just a little bit, let's say someone's pretty dehydrated and they have just a little bit of PRF, always make sure you have a long needle. So either use a 1.5 inch needle, or you can use your cannula to draw it up. But I have tried with a 1 inch needle and you can't get down to the PRF. If you then tip your vacutainer thinking that like, oh, that will help you get that PRF, if you tip it just a little bit too much, you can see how the red blood cells will just come right up into your sample, and then your sample is contaminated. It has red blood cells in it. So make sure that you always keep your vacutainer straight up and down, and make sure that when you're drawing your PRF up, you don't release that syringe, because that will then just cause your PRF to mix with the red blood cells, and then you'll have lost your nice PRF to mix. And then make sure you have a long enough needle so that you can get down nice and far, because you'll have some people where they might be a tough blood draw and you only get half of a vacutainer and you only have a tiny little bit of PRF, and you want to be able to use all of it. So there you go.